specialty orthopedics from hand, wrist, feet, and ankle, total joints, and sports medicine. We also have a outpatient surgical center that our physicians use to treat all kinds of conditions. So let's move into the talk today. I hope you find it very interesting. And if you have any questions, please use the chat box, and Alana will be stopping me if there's any questions that need to be addressed right away. Thank you. So I don't have any disclosures. I don't work for any other company than Baptist Health and MOSME. So this is a logo of our arthritis clinic. This is a brochure that talks about the conditions that we treat here in the second floor, the arthritis clinic. Hip and knee pain, arthritis, degenerative joint disease. I'll see you whether you have x-rays or MRIs. If you have rheumatological conditions, I can also be seen by me. And the phone number is in the bottom of the screen. If you ever want to get a consultation, please feel free to make an appointment. I'll be glad to sit down with you and review images and discuss about the care of your symptoms. So the talk today is hip and knee arthritis. What is arthritis? I'm very surprised that a lot of people in our population don't understand what arthritis is. They think it's just pain or crepitus or noises that their joint makes, and they have to live with it. And it's not necessarily true. People don't have to live with arthritis. Not everybody that has arthritis needs to have surgery, and not everybody that has arthritis requires an injection. So we kind of tailor the symptoms and the treatment based on the patient's symptoms and how much it's affecting their quality of life. We're going to be talking about different forms of arthritis, the symptoms, the treatment, and the results. So arthritis affects 23% of Americans, or if you put it in millions, it affects about 53 million of citizens. So it's 1 every 4 adults report pain in one or multiple joints. So we have approximately 17 people here in our chat right now. So 1 out of 4 of us have arthritis. So it's very, very common. It's considered the leading causes of disability. Doesn't mean that if you have a little bit of arthritis, you cannot work anymore, but it affects the way that you perform at work, the way that you perform with your family, the way that you perform in your daily activities. Approximately 8 million working adults between ages 18 to 64 have had some work limitations, some sort of disability, difficulties going up and down stairs, kneeling, squatting, carrying, pushing, activities that we do every day in our regular jobs. Even prolonged sitting sometimes may affect, especially if you have back arthritis or knee arthritis. Your knees compressed, you may have some limiting factors for that. The annual cost of the direct cost of arthritis is about $140 billion. That includes doctor's visit, oral anti-inflammatories, topical gels, braces, physical therapy, and so on. The normal average worker, they probably miss about 264 days of work with back pain or some back degenerative changes that keep them away from work. And the average is about 264 days. In this study, we're not calculated the indirect cost. The indirect cost is the loss of revenue by the company that you work for, or the loss of income that the patient experienced by not going to work. So $140 billion is a lot of money that is being spent in arthritis right now. So it affects 1 in every 5 women, and in men is 1 every 4. In percentage is 26 versus 19.1. So it's definitely affect more women than men. It could be because one of the reasons there's a lot more women that come to the doctors than men. We tend to play it off and toughen it up, and we don't come to the doctors. Men, hips are affected a little bit higher than females, and in women's, the knees and the hands are affected the highest. Women, they have higher levels of pain than men. Again, men, we sometimes tend to tough it off and take an Advil, put some ice, and we don't show up to the doctor to find out what kind of conditions do we have. So we look at age. This doesn't just happen in the adults, it happens in all the population. We can see that 7.1% of ages between 18 and 44, they are affected by arthritis. 29.3 between the ages of 45 to 64, and then it climbs up to 49.6 ages 65 and above. Ethnicity also has a factor. We have a Hispanic population of 4.4 million that are being affected by arthritis. Non-Hispanic whites are 41.3%. Non-Hispanic blacks are 1.5 millions, and non-Hispanic Asians are about 1.5 millions. Also, this is affected by the level of availability of insurance. People who do not have insurance, they don't come to the doctors to seek medical treatment or to address their medical conditions. So these numbers might be higher in other ethnicities, but they're not being reported because they're not coming in. So some risk factors of arthritis is obesity, genes. So if your parents have arthritis, most likely you're going to end up with arthritis. We have rheumatoid and osteoarthritis. Multiple traumas to the joint is also a big factor that affects and creates arthritis, and multiple surgeries in the joint as well. Any questions so far, Alana?
Let's see. I have one here that says, I have a documented torn medial meniscus, which hurts somewhat, and I'm trying to decide whether I have to have surgery. Does arthritis occur any sooner, whether I have a meniscectomy, I hope I'm saying that right, or just live with it and don't have surgery?
Okay, so right now I'm going to go into the knee anatomy, and I'll touch bases on that, and hopefully we can find an answer for that patient. And if that person has further questions, and we can set up a consultation, and we can talk personally, and we can give them the best advice. Okay.
Perfect.
So the knee anatomy, the bony area, we have the femur, or your thigh bone, the tibia, your shin bone, and your patella. On the side view, you can see it's also there, and on the posterior side. So the knee is not just the front part of your knee; it's also lateral and posterior. The cartilage is this whitish area that you guys are seeing. I don't know if can you guys see the cursor, Alana? The cursor moving?
Yes, we do.
Okay, perfect. So the posterior portion of your knee, that's where we carry most of our weight. There's ligaments and tendons inside the knee that compose the knee as well. You have the patella tendon, the quadricep tendon that attach to your kneecap. Then you have the cruciate ligaments, which is anterior posterior. You have your collateral ligaments. And then in between two bones, we have another fibrocartilage called meniscus. Meniscus goes from the anterior portion to the posterior portion, or from the front to the back, and it's a C-shaped type of cartilage. And the hyaline cartilage is found at the end of our bone. So all that provides protection, lubrications to a joint, shock absorption. As we deteriorate, is the condition that is known as arthritis. So arthritis is the degeneration or the wearing down of the articular cartilage, or the hyaline cartilage that covers the end of the bone. That creates friction, and as friction is created, sometimes meniscles are torn. So it's what we call degenerative meniscal tears. There's other type of meniscal tears that include acute tears, which involves in a sudden twist injury, such as playing tennis, basketball, running, slip and fall. But in arthritis, the most degenerative findings will be a degenerative meniscal tear due to the friction between both bones. This increased pressure creates pain, inflammation, and other symptoms that we'll go over in just a second. So there are multiple types of arthritis found. The most common, I named the three different forms of arthritis, will be osteoarthritis, inflammatory arthritis, and post-traumatic arthritis, which we'll go over in just a second. Osteoarthritis is the most common form of arthritis. It's seen in the greater majority of our population. Genetic has a relationship to this. So if your parents were bow-legged, most likely you will have some sort of deformity in your knee, so more friction or tightness on your inside compartment or outside compartment of your knee. Age-related is seen most common with osteoarthritis. So early changes can be seen as early as 50 years of age. So just as we get wrinkles, we get white hair, we lose our hair, The same thing happens to our joint. It starts having some degenerate changes that eventually cause symptoms. The degenerations are wearing down or loss of the hyaline cartilage and other factors such as meniscal tear, instability of the ligaments, and so on. The joints that are affected the most is the knees, the hips, the lumbar, and the hands. So there's two different type of hand deformities. If you see in this picture right here, I included them. You have this type of nodules in your distal part of your finger and the middle part of your finger, which will be different from the other type of arthritis that we'll touch in just a second. So inflammatory arthritis is a most likely genetic, occurs at any age group, affects women higher than men. The inflammatory process destruct the cartilage of the joint, so the body kind of attacks the joint itself or the cartilage by producing large amounts of fluid, and this large amounts of fluid in the joint, the synovial fluid, tends to deteriorate the cartilage. The wear down of the type of arthritis is symmetrically, so both parts of the compartment, they wear down evenly. There are multiple forms of inflammatory arthritis. The most common is rheumatoid arthritis, gout, and lupus. So inflammatory arthritis, the areas that are more common affected are your wrists and hands. So as compared to the other picture, this patient has more deformities on their wrists and in their knuckles. They have more symmetry on the wearing down of the joint. Other joints that are affected is the ankle, toes, shoulders, and knees. Post-traumatic arthritis normally is caused by an injury that will lead further to arthritis. So if you end up with a fracture very similar to this, most likely you're going to end up with arthritis, or something that was fixed in the past but eventually created arthritis. As you see, the medial compartment in this patient is completely irregular and it's narrow. The most common multiple surgeries, it also leads to arthritis. So patients who end up with cleaning up a plate and all their surgeries may actually end up with post-traumatic arthritis. A picture that I wanted to show is, this is early arthritic changes, moderate arthritic changes, and advanced arthritic changes. So the hyaline cartilage completely wears down, creates osteophytes, it creates bone spurs, is what we call it, deteriorating meniscus, and deformity. Some of the symptoms that are experienced with arthritis is, the most constant is pain. That can be constant and intermittent. Patient may experience pain that comes and goes. As the arthritis continues to advance and you have more loss of cartilage, you will have more constant symptoms and more constant pain. The second symptom most likely seen is inflammation. Patient will develop inflammation or effusion. Effusion is a collection of fluid within the joint, secondary to the friction and the reaction. Loss or decreased range of motion. Patient will limit their range of motion, so instead of a knee flexing to 120 degrees, now they're only able to flex it to 115. Or instead of being able to have a straight knee, now they have a 5 to 10 degrees flexion contraction. Crepitus, most people say that their knee makes some noise, especially when they go up and down stairs, when they kneel, when they squat, when they get up. So that's normal symptoms of an arthritic joint. Arthritis also will cause deformities in the knees. We'll call it varus and valgus, knock knee versus bow leg. So if your parents had knock knee or bow leg, most likely you have the same gene that puts more pressure on the inside compartment or the outside compartment. That will create friction and eventually deterioration of the joint, the hyaline cartilage, and the meniscus. Also causes inflammation and instability. Patients who are walking and they have arthritis on occasion will have a sudden sharp pain and they will experience instability and sometimes even causes them to fall. Pain with weight-bearing activities such as walking, standing, and kneeling is the most common findings. Difficulty ambulating. Most people may benefit from using an assistant device. Decrease of exercise, so people start experiencing pain, inflammation, and the typical symptoms. and they stop doing exercise. They stop going to social activities. They stop going on vacations because they know they're most likely going to fall behind, or they're going to develop a symptom that is going to prevent them from enjoying their vacation and may ruin the vacation for other family members. This also leads to obesity and depression. The less active that we are, the more we gain weight. Especially, I have a lot of people during the pandemic that didn't go to the gym, that didn't get to go outside and do their regular activities, and they had gained a few pounds, and it's affecting their quality of life right now. I have a few more slides on the knee, and I believe there's a question that just popped up, so we'll address it in just a second. So these are normal X-rays findings of a normal knee. The space in between the joint is preserved. You don't have any irregularities. There's no calcifications. There's no bone spurs. In comparison to the one on the right, you can see you can see the loss of joint space, sclerotic changes, osteophytes formation, and that will happen in both sides of the joint and even under the patellofemoral area as well. On occasions, I find cystic changes on the bone itself. That cystic change does not represent that is a cancer. Cystic changes is a synovial fluid that leaks into the bone and creates a bone aisle in there. There's other type of cysts that are also very common seen in arthritic patients called a Baker cyst or popliteal cyst. Cysts are almost like blisters is the best way that I can explain it. They get filled up with fluid, there's an effusion, and people would experience pain with bending, squatting, and compressing that joint. I guess before we get to the treatment, Alana, the question that popped up, can you read it for me?
Sure. Okay, so I have a documented torn medial meniscus, which hurts somewhat, and trying to decide whether to have surgery. So the question is, does arthritis occur any sooner, whether I have a meniscectomy or live with it and don't have the surgery? So I think they're saying, I guess, injury and arthritis, I guess, the relationship to that.
Okay, so let me address that question. So people who may have a meniscal tear, we have to see the presentation because meniscal tear may not be the main cause of their symptoms. If they already have some amount of arthritis settling already in the joint. So we need to get more information on the X-rays, on the presentation of the meniscus, and on the hyaline cartilage of the joint. Should you address it surgically if you don't have arthritis? Yes. If you do have arthritis, maybe you should consider a conservative management for your knee. Does meniscectomy causes further damage? There's always an argument whether removing that fragment of meniscus that is torn will lead to further